giving you an opportunity to get the full story from the people who tell it best. This is Mediacom Newsleaders.
Welcome to Mediacom Newsleaders. I'm Jeff Thie. Holli Zimmerman is here with us from Lakes Regional Healthcare. She is the Patient Access Supervisor. And Holli, welcome. Thanks for coming in.
Thank you. Nice to have you.
You know, we were just talking before we got going here, just the new entrance there to the hospital and some of the new services, surgery, OB and everything. And it has enhanced what was already great service and patient care at Lakes Regional Healthcare, but boy, it's just wonderful.
Yeah, not to brag, it's pretty gorgeous, I have to say. And I've been lucky enough actually to be over in the surgery area, checking in patients over there, and everybody just says how beautiful it is. OB is fantastic. Can't wait to have a baby now.
It's there just waiting for
exactly.
you. But you know, in addition to you know, obviously the beauty of it, it is an enhanced patient care, you know, services and so forth. They're, you know, have
with the new
improved.
facilities, we're able to offer so much more than we ever used to before. It's just fantastic. We have more technology now. We have more space.
Yes.
There's increased patient privacy, especially in the surgery department, which is so critical. It's a great addition.
You bet it is. Well, and in addition to that, you've made some improvements in patient medical records lately.
We have. In the midst of all the construction, we also completely changed our computer medical records. So that was a big undertaking that we went. That kicked off on May 1st. So if you've come into the hospital and we ask you again for your insurance cards and your driver's license, ask you all your information again, you're thinking, I just gave this to you. That's why we updated our computer system, so everything kind of got revamped a little bit. But the good news with it, we're now aligned completely with Avera in their computer system.
Right.
So if you have gone to Sioux Falls, the Heart Hospital, any of our facilities, we can access those medical records. There's no more waiting for a phone call from a doctor's office or the paper charts to come. We don't have to deal with that anymore.
Yeah, that's right. And you know, I can think of the days where you've seen your local doctor, you're being sent somewhere else, and well, make sure you stop when on your way. Stop and get your information to take with you. It's right there at their fingertips.
It's so much easier now, especially if you come into the emergency room. The information is right there, so we don't have to wait for old charts. So, because that's a critical time, it's very important that the doctors are able to access all those past medical histories, all your medications, everything's right there at their fingertips. It's very exciting.
Absolutely. Well, and let's face it, in emergency situations, seconds count.
Exactly.
And if you're retrieving information when you could be acting on what needs to be done, makes a difference.
It does.
You bet. So what is Avera chart?
Well, Avera chart, it kind of goes along those same lines that it integrates all the Avera systems, but this is for the patients to access, which I think is very exciting. I played a bit around on it myself. What you do is that you just have to go into averachart.org and you can register, and obviously us at the hospital will help you register with that. But you can see all your past medical visits, if you have upcoming appointments. You can send a message to your doctor, which is really cool. That's actually my favorite part.
Sure.
So, like, say you have a question, he just prescribed some medication, and you're quite sure, do I take this with food? Do I not? Will this interact with another medication? Shoot them off an email, and it goes right to the doctor's office, and they'll get back to you. You can pay your bill online. You can see, what I think is really cool, you can see your test results. So you say you went in for lab, and you wanted to see what your results were.
Your blood pressure or your cholesterol, all that stuff?
Lets people kind of take charge of their health care, which I think is awesome.
You bet. Well, and I know, you know, that obviously people are concerned with, you know, whether it's their credit card, their bank account security.
Absolutely.
And I assume
this is locked down as you can get. It's behind the Avera firewall, which is like a fortress, I gotta say. So nobody's
but that's what we want.
Exactly. Yes. Nobody's going to be peeking at your information. The only ones that can access your information are the ones that you say can.
Right. Yep.
So you're able to set a proxy. Say maybe you have an elderly parent and you want to see their information.
Sure.
All they have to do is sign a proxy form. You can get into their medical record and you can keep track. I know when my mom was in Aileen Health, that would have been a huge thing.
When you're part of the caretaking team to be able to access, absolutely.
Exactly, because it's more of a team, and you're a part of a team.
Yep. Holli, if people have questions, they'd like to find out maybe more, contact the hospital.
712-336-1230, that's our main line.
Okay.
You can also visit averachart.org.
Thank you for the information and talking to us today.
Thank you.
You bet. Holli Zimmerman here with us today on Newsleaders, and we invite you to join us next time to get the full story from reliable sources right here on Mediacom Newsleaders.